Hi, this is Dr. Bernstein with another session of Dr. Bernstein's Diabetes University. We're going to talk about something that I only just learned about. I learned that endocrinologists are now advocating statins for children instead of normal blood sugars. I knew they were advocating statins for adult diabetics, but I had no idea that they were advocating them for children. And this is, I guess I'll have to call it a crime, certainly since they are substituting the statins and ACE inhibitors and aspirin for normal blood sugars. And they're still advocating high carbohydrate for children and high blood sugars. Now, we know that the major cause of death for diabetics is congestive heart failure. It's a weakening of the heart, either due to multiple heart attacks or indirectly to high blood sugars. Now, to give you an idea of what one can anticipate if you use my book as a guide, I've only had it as a guide or my guidelines as a guide since around 1973. I'm now 80 years old. My last calcium score, which can range from 0 to 5,000, my score was 1. How did I do this? I did it with normal exercise, with normal blood sugars, exercise, no statins, no aspirin, no ACE inhibitors. Now, I don't oppose such things as ACE inhibitors for people who already have kidney disease, but I had severe kidney disease when I started on my low-carb diet and measuring my blood sugars. So I did this just by normal blood sugars and exercise. Now, let's take a look at what predictors there are of heart disease and congestive heart failure that you can measure. Most endocrinologists are looking at total cholesterol, maybe they're looking at LDL, but they're totally ignoring things that are much more predictive of heart disease. They're ignoring the imaging studies such as coronary artery calcium score and CT angiography, that's computerized tomographic angiography. Now, I'm not recommending that kids get imaged. It's not necessary, and you probably won't find anything. But when they get older, they can have imaging done if they want to know the status of their coronary arteries. What they could do nowadays, if the parents are worried, is measure their oxidized LDL. The LDL deposits that are found on arteries, or if we go back in time to the early discovery many years ago of fatty deposits on the aortas of young people who had been killed in war, what they found was not LDL in these fatty deposits. What they found was oxidized LDL. And oxidized LDL is elevated in the blood of people, of diabetics with high blood sugars. Also in the blood of people who eat a lot of carbohydrate. Also found in the blood, if you're doing research studies, is glycosylated LDL, LDL with glucose stuck to it. Unfortunately, this is only a research tool right now. You'll find it in labs that are studying diabetics with high blood sugars, but you won't find it in routine clinical labs. You can find, however, the oxidized LDL. There are also inflammatory measures. We know that diabetics with high blood sugars also have high measures of inflammatory markers. And the list of inflammatory markers is great. The one that's most commonly measured is C-reactive protein, which is a good predictor of subsequent heart disease. Homocysteine is a good predictor. And there probably are a number of them, but I would focus on C-reactive protein and oxidized LDL. And as I said before, the endocrinologists who should know that this is a very good predictor are not even asking for it at the lab. And you can get this from any major clinical laboratory. Quest measures it, LabCorp measures it. The people who are providing them with the test is a lab called Steele. I believe it's STIEHL. And here we have doctors prescribing statins with all the potential side effects to diabetics. So if I had to summarize the things that one might want to measure in the blood as predictors of heart disease, I would pick as number one oxidized LDL. Then I'd pick total HDL. I'd look at homocysteine. I would not look, and I would look at lipoprotein small a. Lipoprotein small a can be inherited to be elevated, but it can also be found to be elevated in women who are estrogen deficient. It's an important factor to look at. But the factors that are being looked at by endocrinologists are not the ones that are the best predictors. And they're recommending statins for kids who have normal blood sugars now. And there are many kids who are being treated according to my book, Diabetes Solution, who are walking around with normal blood sugars, and they're being given statins. Statins have their own risk profile, usually for destruction of muscle, where they can cause muscle cramps, but they can also cause severe autoimmune muscle inflammation and even infection, where people actually develop an inflammatory disorder of the muscles that's not reversible, that doesn't go away when you stop the statin, and you could read about this on the internet. It's not common, it's rare, but it does occur. And the statins must be monitored very carefully. Not only do you have to frequently ask the patient about symptoms, let's say maybe once a month, once every 2 months, but you also have to check their blood for factors that are indicative of muscle damage, like CPK, that's creatine phosphokinase, and myoglobin levels. So you don't casually give statins to kids, and you certainly don't give them instead of controlling their blood sugars. One problem with the endocrinologists is that they don't know how to control blood sugars, but they do know how to prescribe statins. Well, thanks for listening. If you want to listen in on my monthly free teleconferences, look below for instructions. Good luck, and we'll see you in the next session. The bulk of what you've heard on this video appears in my book, Dr. Bernstein's Diabetes Solution, which is available at most internet and local bookstores. It is published by the Hachette Book Group. I'd like to remind you that we have monthly free teleseminars every month at the site askdrbernstein.net. Doctor is spelt DR, so askdrbernstein.net for a free monthly teleseminar. Sign up a day or two in advance so that you get a reserved seat. Good luck, and thanks for listening.